I've been on TV a few times. I made a lot of mistakes. Good afternoon. Welcome to the Scrub Experience. This is Jamie. She is our scrub tech, and we're happy to report that she just matched into an excellent general surgery program. Yes, so today what we're going to do is we're going to go through some basic tenets and fundamentals of what's expected of you in the operating room, how to enter, how to scrub effectively, which is very, very important. And then once you do that, we're going to line you up in front of some tables, and then Jamie and I are going to gown you, okay? And then we're going to kind of go over some basic things, do's and don'ts in the operating room, so when you go and scrub for the first time, you look good, you look professional, and hopefully you will impress your attendings. Has anyone scrubbed before in the OR before? Here? You? Okay, good. Well, maybe we can teach you something, okay? So what we're going to do, we are very grateful for the vet school to allow us to use their scrub sinks. And we're not going to have to, because it's not really a sterile environment at this point, we're not going to have to put in on your hats and gloves. I mean, your hats and your booties and your masks, but normally you would do that before you enter an operating room. We all know that. So we're going to pretend that you've already done that, and you're going to follow Jamie, and then we're going to line up in the scrub sinks, and Jamie's going to show you how to scrub your hands. I know you've already seen the video, and then you're going to line out, come out, and we're going to gown and glove you and go over some basic principles and see if you have any questions. Cool? Great. All right, good. Thanks.
All right. Hello. My name is Jamie Serrano. I'm a fourth-year medical student at VCOM, and before coming to medical school, I was actually a surgical technologist for 4 years. So I'm hoping today to use my experience in the operating room to help you learn how to scrub. So this is a traditional operating room scrub. You do about 5 minutes, so it's timed, and you also do a specific pattern from your fingertips to your elbows on both sides. One of the biggest principles with this is to always keep your hands at least level, if not elevated a little bit, to make sure that the water is running from your fingertips to your elbows. That way the dirty water isn't running back up your arm to your hands. The goal at the end of this is that your hands will be as clean as possible. So we start by opening our scrub brush. And inside, you're going to see this little blue pick. This is to clean your fingernails. So we're just going to turn on the water to wet our arms. And once they're wet, you can start cleaning under your nails. I'm going to clean under each one. After you're done with that, you can drop the nail cleaner and pick up your sponge. You want to wet it and get it nice and foamy. Get a real good lather. And then we start with our fingertips. So you go back and forth on your fingertips with the brush side for about 10 strokes. And then you go to your fingers. So every area that we clean has 5 sides. We have a side, a front, a side, a back, and in between. So I'm going to do each finger that way for roughly 10 strokes in each spot. And you notice the whole time I'm scrubbing, I'm keeping my hands elevated. That's a very important step. Then you come to the thumb, do the same thing. Okay, so fingers are done. Then we move to our hand. Our palm has 2 sections in the front. 1 half, 2 halves. And then the side. And then we rotate our hand to do the back in 2 sections. And then we kind of make a little duck with our hand and do the thumb side. Once again, just to make sure we covered all of our areas. My sponge is getting a little dry, so you want to make sure it's nice and soapy the whole time. And then we move down to our forearm. We divide our forearm into 3 sections, top half, middle, and bottom. And again, each side has 2 areas in the front, the side, then we flip to the back, then we move down to the second half. And again, keeping my arms up the whole time that I'm doing this. And then the bottom half. And we only want to go to about 1 inch above our elbow. That's going to be where you stop. Once you get this whole hand done, rinse your sponge and do the same exact thing on the other hand. So again, side, front, side, back, in between, up to the next finger. And there are a few different methods. There is the time method where people just kind of come out and just scrub their entire hands and arms for a total of 5 minutes up and down in no methodical way. That's an accepted way to do it, but this way I am sure that I'm getting every part of my hand and my arm clean, and it's still taking me about 5 minutes to do it properly. So once I have both hands and arms clean, I got my scrub brush and I rinse. Whenever you rinse, it's the same principle. Fingertips to elbows, always making sure that the water runs off of your elbows on both hands. So, come in, rinse. You can rotate your hand a little while you're rinsing. Get to the elbow, the other one. Then you turn it off. When you're dripping dry, you want to drip off the elbows again, same thing. You don't want to drip like this because that just defeats the purpose of everything we did. Drip off the elbows, and then you're going to head into the OR like this. Once you get in there, you'll find your scrub nurse ready with a towel, a gown, and a glove, ready to get you into surgery. Good luck. Okay, so to get started, you can all kick on your sinks. You just kind of put your knee on the water side. You're going to open up your scrub brush. Just peel it open. Set it on the back of your sink, and you'll see this little blue nail cleaner. Okay? So set your scrub brush down, take your nail cleaner. You can get your hands wet, and then clean under all your nails. Good. Drop that little cleaner in the sink then. Take your scrub brush, put it under your water, get it nice and foamy. Just stick it under there. There. Lots of bubbles. Alright, so you're going to start with the brush side, start on your fingertips, and kind of go back and forth. Each back and forth is 1 stroke. You do 10 strokes, okay? Back and forth on the fingertips. Once you're done with the fingertips, you can use the sponge side for the rest of your arm. You're going to do the side of your finger, the front, the inside, the back, and the webbing. 10 strokes each spot. Then move on to your next finger. Side, front, side, back, middle. Side, front, side, back, middle. Okay? Do that for every finger. And the whole time you're scrubbing, you always want to make sure your fingertips are above your elbows because you want all of the contamination to run this way. Your hands have to be the cleanest thing in the sterile field because when you're working in a patient, you're working with your fingertips. You're not going to be down in there with your elbows. So make sure that your hands are the cleanest. They can be level or they can be up a little higher, but never let your hands hang like this, okay? Good. Once you get done with your fingers, you move on to your hand. You do the side. You come to the palm and you do 2 regions in the palm. Then you do the side and you do the back. Okay? Once you do that, you move to your forearm. 1, 2, 3, 4, 5 zones. So you cover 1/3 of your forearm. Then the second third, same thing. And then the last part should be at your elbow. And everything should be clean. Once you're done with that arm, you rinse your sponge and you do the exact same thing down the other arm. This whole process should take you about 5 minutes if you're doing a proper scrub. To open your own, they probably won't, but just in case. It's gonna come folded, kind of like this. Looks like a little tab right here. So if it's on like a small table like this, you would just grab that tab and open it up. Next tab, open. And there'll be a little arrow in each spot that you just grab and you open like that, okay? So that's your field. You can't kind of go back and forth with it or anything, just once it's open, that's it. Also your gloves, they'll ask you, if you know your glove size, you can say, hey, can I grab my gloves? Or you can say, I'm a 6.5, where would I find my gloves? Or if you don't know it, the nurses are very good and they've done this for a while, so you can go in and say, what gloves do I need? You know, and they'll get you within about half a size typically, and you can go up and down based on your own comfort. So I'm a 6.5, 6, so I double glove. So this is a 6.5. When you open things onto the field, same thing. With confidence, do it once and that's it. So I grab it and I just kind of open towards the field and let it drop, and that's it. I don't hover over top, I don't do anything weird, I just straight onto the field. So I'm going to show you how you dry your hands. Whenever you grab things off of the field, same thing. Don't come from the side and grab, because now I'm touching the entire field with my hand. I come directly over top of what I want, I grab it and I get out of there. So you'll see your towels are on top of your gown. You just come straight in, you grab it kind of in the middle and you pinch and you pick it up. So go ahead. Good, yeah, take it. Okay, so now take a step back from your field, that way you don't contaminate it. And open up your towel. You'll see that it's a rectangle. So your hands are now cleaner than your scrubs currently. So you don't want to touch this on yourself. So the whole time you're drying, you're going to kind of keep your arms out a little bit. We're going to use 1/2 for one hand, 1/2 for the other. So you can kind of turn it a little bit and just use this half. Same as when you're cleaning your hands, you do fingertips to elbows. So I do my fingertips first, then I do my hand, then I kind of work my way down my arm. If I didn't get my fingers well enough, I can't come back up here. So you have to make it good while you're up there. Once you get to your elbow, I usually fold mine in half, but you can just flip it over, whichever makes you happy. And use the other half of it, okay? And do fingertips, hand, down to your elbow. Then the next thing you would do would be ask your circulating nurse, is there a garbage can? Where should I put this? A lot of times they'll just stick their hand out and say, give it to me, and you drop it in their hand. But for the purpose of this lab, go ahead and just drop it where you stand. Good, okay, we'll pick those up at the end, so we don't make too much of a mess around here. So I'm gonna show you how I gown and glove myself, but then we're going to gown and glove you, which is what will happen in an operating room. They're not going to have you do this right away, but something to see, it's always good. So same thing, when I grab things, I just take it from the middle, and get out of there. You'll see that it's kind of folded on one side, that's the side that's gonna be towards me. And I open it up, and I see where my arms go. So I put one arm in, watching where the sleeve goes the whole time, other arm in, watching where the sleeve goes the whole time, and my gown's on. Somebody who's not sterile would come and tie up the back. So that's typically, again, your circulating nurse or a very kind physician who's in the room and not scrubbed yet for one reason or another. Once that is done, then I have to put my gloves on. The trick to putting your gloves on is that you have to put them on without touching them, because you're clean, but you're not sterile. You're alive, you can't be sterile, but the gloves are. So I open it up, with my hand still in the cuff. I pick up one glove. The surgical gloves are different than the ones we gave you. They're folded so that you can see the thumb right there. So I know where my thumb is and where that thumb is, so that's right where I grab the glove. My thumb against that one, then I flip it directly over my hand, and I pull my hand out. Okay, so one glove is on. Now I can use this hand because it's now covered in a sterile protection. So I just grab this other one, same thing, thumb to thumb, flip it straight over, and pull my hand out. So that's it. My gloves are on. Okay? That's something you can practice if you have like a pair of sterile gloves at home. You can just practice gloving yourself. That's a good idea. The last thing is the dance. So don't put your arms down. There you go. So you're going to take this little card. This string is still sterile, and this cardboard, the dark side is where it's going to become contaminated, and the light side is where I can still touch. So I'm going to give it to somebody who's not sterile. Just going to grab there. I'm going to spin around, take that, and tie it. So now my gown is secure, and I'm ready to work. You're only sterile, even with this gown on, from about your chest to your belly button. So even with this on, I still can't drop my hands. I can't go up here. I can't do anything wild like that. So I usually just put my hands on my stomach or right on the sterile field, because then you're safe. As long as something sterile is touching something sterile, you're fine. So that's usually what I do. All right.
Sterile to sterile.
Sterile to sterile. At same level, dirty to dirty, clean to clean, whatever, as long as you're not dropping down the levels.
So if we were moving, if I was sterile, you were sterile, and this is the OR table.
Yeah.
So how would you pivot?
So if he is working and for some reason I need to get over there, he says, come up here and hold this retractor. I can't cut in between him and the OR table. That would just not be good. I also don't want to go behind him because your back is not sterile either. I can't monitor what's going on back here, so this is not sterile. So I don't want to contaminate myself on him either. So same, sterile to sterile, not to not. I would just pivot behind him. I would just take one kind of hardy step back like this, so that we're back to back, and then I come front to front again. That way, I always know where my front is. I'm not contaminating him, and I'm not contaminating the field. Okay?
Cool. Now what we're going to do is we're going to go, Jamie's going to start on that side, and I'm going to start on this side, and we're going to gown and glove you. As we said, that these are real gowns, courtesy of Blue Scale. The gloves are not sterile, but I think we can get the point across. And then we're going to turn you, and we always make a bet about how many people we think are going to turn the wrong way. Mm-hmm. Out of this group, I'm going to say 2.
We'll go with 1.
Okay,
We'll
we'll see.
go with 1. Yeah, we'll see. All right, I'll start over here.
Okay.
So, you're the first. The goal is for me to put this gown on you without contaminating it, without contaminating myself. Because currently I am sterile and you're still not. So if you mess up your health, then you're stuck. So what I'm going to do is I'm going to have you step back a little bit because the corner of this is not sterile. I'm going to open this up. I'm going to protect my hands under here. And you see where your arms go? You just go straight in. Perfect. See? Watching where your sleeves go, you did that. And you didn't like hit me in the head. You didn't like swimmer dive, which some people are like, I'm doing this, and they go like straight in. And no, you did very well. So the nice nurse will expose your hands. So they'll do kind of like this to make your gloving a bit easier. So, and they also, when they hold the glove, they're going to protect their hands like this. And they're going to put your thumb will always be so that you can just put your hands straight in it. There shouldn't be any guesswork. You can just put your hands straight down in. So go ahead. Oh, sorry. Well, I'm glad you did that. So when you go in and then out and then in again, your chances of hitting my glove are pretty good. So even if you get like some weird little claw formation, once you get in there, just keep it until you put your other glove on, and then you can fix yourself with your 2 hands. So it was like you did it on purpose. Thank you. All right, so now with this one, you can take this hand and grab the bottom like that, and it just makes your target even larger. Perfect. Straight in. So good. While that was happening, somebody who's not sterile was behind here, just fastening this Velcro. So that is done. Last thing is to dance. Okay. So the short side is the side you can see. The long side is the direction you're going to turn. Okay. So you need to take the short side and keep it for yourself. And give me the card. Got it connected. Oh, sorry. Okay. Now you turn this one. The other one? Yes. Good. Okay. And now take that side and tie yourself. Tie a little bow. Okay. So that's it. So you turn towards the direction of the long side. That's the thing that we make bets on. And then you just tie yourself. You can touch that because that's part of your gown. It's sterile. And then once you're done with that, you can put your hands on your belly or on the field, and you're done. Okay. All right. Next. So it kind of came a little bit low because this was my sterile experience. You don't want to contaminate the gown. Just kind of straight in. I had a very awkward surgeon make me give him a hug before every time I gown him. Like he wanted to just come like this, and then he could start coming at you, and I was like, it was awful. All right. So your thumb is going to be so you can drop it straight in. Perfect. See? No thinking involved. Straight in. Well, you don't want to put it on top because you can touch that hand and come under the cuff. So use this hand under. Yeah. See? So it's protected. Just take it. Just take it. Go.
Okay.
Yep. Perfect.
So
now you can fix it. Yep. Because if you come back out, then your risk of contaminating me. That's when it happens. So you just gotta commit. So okay. Someone else did that.
Okay, so
Now-
I can touch the white part, right?
You can touch everything right now because it's still on you.
Okay, so I can use this.
Keep a hold of that. Good.
And then I go that way.
Mm-hmm. Yes, you do. All right.
Yay!
Perfect. That's it.
It is totally like wrap
And that just keeps the back from like flapping open and contaminating things as well. So, because your back is not sterile, so it's not that it's making your back sterile. Perfect. Good. Just watch the arms that you're not going out too far because there will be things around you sometimes. So, good. Okay. Again, your thumb should just drop straight in. Perfect. Good. Okay, so you can take that hand and grab the bottom of the cup. Good. Perfect. Good. Okay. Someone else did the Velcro magically. Not me. All right. Good. Good. It's like you've done it 1,000 times. Yeah. And the thumb, you should just drop straight in. Ooh, it's okay, just take it, whatever you get. That's fine.
It's like a surprise.
So you can fix that later. Just keep what you get. The group that was here for Valentine's Day, I was like, commit! They were like,
They were probably guys.
yes, most of the ones that weren't committing.
Go figure.
Just
Okay. Okay. I just love it.
good. Perfect. All right. One more. That was good. No, it was good. You can fix it later. You did. You absolutely did. Perfect. Now you can fix both of those. Great. Last step. All right. Good. That's it. Yep. So now you can come back to your sterile fields, and once we're all finished up, we're going to show you how to take the gowns off after the case. Okay.
What do you want us to start with?
Oh, you're good.
Okay.
All right, so case is over. You are no longer concerned about contaminating the patient. The patient's all sewed up, dressings on, they're out of the room, but now you have to take your gown off. So this is covered in blood and whatever else might be on it. So the goal now is to keep you safe from this. So the first thing that you would typically do is this tie. You could rip it off, but we're going to keep these. So untie it in a civilized manner. You can Hulk out during your first case and it'll be wonderful. All right, untie. Then you're going to take right here and just kind of pop your Velcro. Good. When you pull the gown off, you always want to roll the contamination inward so that you're not touching it. So when it comes down, I just kind of roll it on my hands like this and just kind of make a little contaminated ball and keep your gloves on because you don't want to touch this without gloves. Okay? And the actual surgical gloves are a lot tighter than the ones you have on, so if one slips off, that won't happen in the OR. So you can set that on your sterile field. You would throw that away. Then the last part is taking the glove off. You want dirty hand to touch dirty glove. So I take my finger, hit the palm, and just grab the bottom and pull it off. And now your clean hand, you don't want to touch clean, so you go underneath the glove, hook and pull it off, and then throw those away too. And then wash your hands. That's it.
Normally what you is you introduce yourself, mostly to the circulating nurse and the scrub nurse. You say, hey, I'm Jamie Serrano. I'm here to assist Dr. Briner in surgery. I think I wear 6.5 gloves. What do you think? Show me your hands. Can I get the gloves for you? Can I get the gown for you? You need to be as helpful and as cheerful as you possibly can to be a team player. The next thing you do is I like to put my name up on the bulletin board, you know, the little white thing, Jamie Serrano, MS4, VCOM student, and they like that when you do that, so they know who you are in case they need to talk to you, and sometimes they actually enter it into the medical records as your part of the procedure. When you're finished gowning and gloving, okay, the nurse will help you. You just stand there like that, okay? There's going to be a lot of activity on the OR table. They're going to be prepping, draping. The anesthesiologist is going to be doing his thing. Once everything sort of settles, hopefully the chief resident will look at you and say, Jamie, I want you to stand here. If that doesn't happen, and if there's not an emergency, and if they forget about you, say, you know, Dr. Briner, where would you like me to stand? And hopefully it's not, you know, outside the operating room. Normally they'll say, why don't you come up here and put your hands on the patient. And what you do is you're going to approach the patient and you're just going to put your hands right on the patient. Okay? The reason you're going to do that is because that's sterile. All right? If you drop your hands, you're not sterile. If you touch your nose, you're not sterile. And the biggest point of all of this is sometimes you break sterile technique and sometimes you don't know about it. Sometimes, because you're not surgeons, hopefully one day you will be, but sometimes you'll scratch your nose or scratch your neck. If you do that, or more commonly what will happen is during the procedure, the suction will fall. It falls off the table all the time, and instinctively, like a reflex, you try to grab it. You're trying to do a good deed, but once you go beyond that point, you are now contaminated. At this point, what you do is you tell the resident, the doctor, Dr. Briner, I think I broke sterile field. And they're going to say, well, what did you do? I said, well, I did this, that, and the other thing. And they're going to say, okay, we need to rescrub, or they're going to re-gown and glove you. But you got to tell them if you broke sterile field. Why is that? Because you don't want the patient getting an infection. That's number one. Number two, the circulating nurse will know that you've broken sterile field, and they're going to say, hey, Dr. Briner, Jamie just, put her hand down, and I'm going to look at her and say, Jamie, did you do that?
And then you say yes.
Yes, yes.
Don't
And
say
so,
no.
yeah, but the biggest thing is that you don't want to contaminate the patient. You want a nice, clean surgery, and everyone has broken sterile. I have done it before. I'll be, even as an attending, something will drop, and I just reflexively go for it, and I'm like, oh, great, I did, do it. So everyone's done it. I'll tell residents, I'll tell you, no matter what mistake you've made, I have made that mistake 100 times. No matter what mistake you have made, I have made one that's 100 times worse, okay? It's always good to be honest with the attending and the nurses, and be nice. When you're done, you say, Dr. Briner, I'm going to accompany this person, the patient, to the recovery room, if that's okay with you. Now, they may want to do another case, they may want you to do an H&P, but for God's sakes, don't walk out of that room following the attending and leaving that patient on the table with the anesthesiologist trying to extubate them. I want you, your job is to stay with that patient and accompany them to the recovery room to help them move the patient off the bed into the stretcher, and then let the chief resident know, hey, I'm going to be in the recovery room when you're ready to do the next case, or when you're ready to round, come get me. Okay? That's going to mean a lot. When you're done, help clean up a little bit. Just be as helpful as you possibly can. Okay?